actually know when a client is ready to move into EMDR reprocessing. This is one of the toughest clinical judgment calls that we have to make as EMDR clinicians. Newer clinicians are often terrified to move too quickly, and I think that veteran clinicians often recognize that maybe we spend a lot of extra time in preparation that we didn't need to when we were newer as well. And honestly, personal opinion, I still would rather have that happen than rush into reprocessing before a client or their nervous system is ready. So today, I want to talk through what I'm actually assessing before we move into phase 3. If you're new here, welcome to Club 07 Clear, where we make EMDR more relational and human. If you're interested in the clinical decision making that doesn't get fully covered in basics training, you're going to want to subscribe.
1, 2, 3, 4.
Now, I will be so honest with you in that I definitely move into reprocessing faster now as a veteran EMDR clinician than I did when I was new in the modality. And that isn't because I care about client safety less. It's actually because I trust myself and I trust the AIP model more. I trust my preparation. I trust my assessment skills. I trust my ability to flex and fit a client's needs in the moment. Now, does that mean I am a perfect EMDR clinician? No, of course not. I am always learning and growing. But I say this so that newer EMDR clinicians can know that your answer to when you move into reprocessing may be different now than it is a few years from now. And that's okay. And actually, because readiness is something that I'm asked about all the time in consultation, especially with folks completing their basics training, I recently created an EMDR target planning packet that includes a readiness assessment, pre-flight checklist, and target mapping. So you have all of your things in one neat place. What I like about this is that it doesn't just help you assess when a client is ready, it also walks you through some of the due diligence that we need to do as EMDR clinicians to really ethically prepare our clients to move into reprocessing. Have we identified a stop sign? Have we explored any sort of medical concerns that might impact reprocessing? Have we assessed dissociation? Are just a few of those pieces. This can help us make sure that we lay the groundwork for safe and ethical EMDR reprocessing. So if you're someone who likes a little bit more structure like me around treatment planning and readiness assessment, I will be sure to link that below so that you can access it. The thing that y'all are here for, what are the 3 things that I am looking for to ensure that clients are ready to move into reprocessing? Here are the 3 biggest things that I am paying attention to. 1, ground level stability. 2, our ability for our client to access state change. And 3, our client's sense of dual awareness. If you take nothing else away from this video, I want you to take away those 3 things. So first, we've got ground level stability. And what I mean by this is what's happening in that client's life right now? How stable is it? Are they sleeping? Are there acute safety concerns? Are they currently experiencing psychosis? Are they using or abusing substances? Are they in a relationship that is incredibly chaotic? Are they experiencing current day abuse? Are they physically depleted? Are they financially unstable? All of these things are important pieces of information for us to have to understand how stable their internal and external world is. Maybe a client just lost their job, maybe they just had a baby and they're getting like 2 hours of sleep a night, or maybe they're going through a really chaotic breakup. These might be times where we pause, we do some talk therapy, we focus on stabilization or resourcing. Not always, but these major life transitions or these changes in overall stability are definitely things that I'm paying attention to. The second thing that I'm looking for is state change. The most simple way that I think about state change is a client able to move from feeling some level of yuck in their system to feeling okay enough? Is their nervous system flexible enough to shift states, or is it really rigid? When they experience distress, are they stuck there for hours or even days? How are resources actually landing for them? Maybe we practice some pendulation. I love using that in phase 2 of resourcing. dipping into some yuck, and then coming back to I feel okay enough. And they move between activation and feeling grounded and stable without completely losing themselves in the process. Can they reconnect to me, the room, the stuff around them? Maybe even can they access another perspective? Great example of state change would be I'm talking to a client about a recent motor vehicle accident that they've been in, and I see a physical change. They tense up a little bit, they start getting a little bit tearful, and they're clearly upset as they are sharing this incident with me. As I'm noticing these physical changes because of the relationship that I have with them, I'm going to ask them to pause. Can we take a deep breath together? Here's some tissues. Let's blow our nose. And after a couple of minutes, they seem more settled. Their breathing is back to normal. Their tears have stopped. They're not feeling wonderful. They just talked about a really hard experience, but they are okay enough. That is state change. And this doesn't just show up in sessions, right? We can really listen to what our clients are describing happening outside of session. Have they had an argument or learned some new information or what have you, gotten upset, and then are they able to tell you, hey, I used this resource and it was really helpful, or hey, yeah, I did some journaling and I was able to carry on. If someone inside a session and outside of session is not able to access state change, that is a really good indication that they are not ready to move into EMDR reprocessing. The third thing that I am looking for is dual awareness. This is the greatest thing about EMDR, that use of bilateral stimulation forces us to have dual awareness. That idea of we've got one foot in the present moment while we've got one foot in the past. So a real life example of dual awareness in session would be like a client discussing an assault that happens in college. And as they are sharing it with us, it is very clear that they understand that it happened in the past and that they are fully connected with us. They might be crying, they might be activated in their system, but they are not pulled back into that past. They're not re-experiencing, they're not completely disconnected and dissociated. They still know I'm here, I'm talking to my therapist, I'm in this office, and while I might feel some level of unsafe in my body, I know that I am truly safe because of all of the things that are connecting me to this space. If a client loses all connection with the present moment while they are with me, or even if they share that that's happening a lot outside of session, those might be good indications that we need to do a little bit more resourcing, that we need to tax our working memory a bit more. I will have a video coming out about that at some point. We need to increase that dual awareness just a bit, or that we simply need to kind of slow down and move at a slower pace. This is different for each and every client, and that's why consultation is so important, so that you can really talk these things through with a consultant. Nonetheless, this is another thing that we can assess in session. When a client becomes activated, are they able to orient back to me? Can they use calm place and container? Are they able to ground enough to know that they are connected to me? We might even ask, what are some cues that you see in your space and that you see in my space that let you feel connected enough to me in this moment? Dual awareness is the part that allows us to do more exposure-based therapies without re-traumatizing clients. So it is extraordinarily important that our clients are not doing reprocessing when they have 2 feet in the past. We need that 1 foot in the present moment for us to do safe and effective EMDR reprocessing. This is also why I view EMDR preparation or phase 2 as more than teaching coping skills, right? We are tracking our client's nervous system. We are trying to assess what it's like for them in our sessions and outside of our sessions to gauge whether we should be moving into reprocessing. Is there enough safety, flexibility, and connection with us so that we can move through all of the difficult targets that we plan to move through together in a way that is safe and effective? And I think that both newer clinicians and certainly our clients sees phase 2 as just something like we need to check off, just something that we need to do to move into the real EMDR work, and I remind you, and I remind all of my consultees that EMDR is an 8-phase model. Even if you're not doing reprocessing, you are doing EMDR, and it is important. Good EMDR and good EMDR therapists are not rigid. We know that there is a protocol, we respect fidelity, and we have to adapt because we are working with humans, and humans are complicated. Nervous systems are complicated. So we have to have some level of flexibility.